Hello, my name is Beverly Hurst. I'm a Macmillan nurse. I work in Bradford and I've been in post 8 years. My role is to look after women with a gynecological cancer, not only themselves but their families as well. The type of support I provide starts in most cases before the actual diagnosis. People come with suspected cancer, so I tend to be there in the clinic with the consultants, talking to them about the investigations that we need to do to make that diagnosis. It's at this time that patients are the most vulnerable. Quite often they're very frightened, they know why they've come to clinic and they don't know what the next step is. I think one of the most important things I can do is make sure they have a plan of action so that they know what's going to happen next. I do find after the initial consultation that quite often I do get a phone call in the next day or so from the patient. One of the things I always give the patient is a little card with my name and number on, because it's very common these days that patients will say, "Oh, I couldn't ask the doctor that. He's not there to answer those sort of questions." Our consultant's very friendly, but even so, we still do get that. So in the next day or so, I often get a message on my answer phone or a phone call asking me what happened at the consultation, what was going to happen next, and can I help sort it out. If there is a real problem, I will go out and visit a patient at home and talk to them face to face. There are lots of things that I do which are very difficult to quantify being a Macmillan nurse. I do spend a lot of time holding patients' hands, and I think people associate us with that, but it is quite important to make contact with a patient. If I'm sitting with a patient by the bed, I will often hold the hand, particularly if they're upset or we're going through the diagnosis of what's going to happen. Patients, even if they have friends or relatives who've had cancer, it's very, very different when it actually happens to them. And I can only hope to empathise with a patient. I see that as one of the most important parts of my job, that I try and put myself in their situation. How would I feel? If I get involved with the patients, if I get to know them, if I know their background and their families, I think I can help them much more than if I just see it as a job that needs to be done each day of the week. In my role as a Macmillan nurse, it's not only the patient that I actually support, quite often it's the carer, so that would be perhaps in the husband or the family, maybe the daughter, son. I have many examples of patients where I've really got to know the family and gone on to support the family even if the patient has sadly died. There are also just the practicalities of the home. It may be that they're finding it difficult to get in and out of the home. Maybe they live in a house with lots of stairs. Can we make arrangements to provide a ramp, or can we make arrangements for a downstairs bathroom? All of these things can make a big difference. Even simple things like a cushion for the chair so that they can get in and out of the chair easily. All these sorts of things are all part of my remit. I mean, one of the strangest things I was ever asked was to help look after a dog. In that case, she was just more concerned with the dog that was in the kennels than her actual operation that was taking place at that time. I was quite happy to ring the kennels and make sure that the dog was okay. The dog was okay and she was okay. The things that is nice is when patients do survive their cancer, and a lot more survive than don't, and to see them getting on with their lives and getting back to what was normal for them before their cancer diagnosis, I think that gives all of us, not only myself, the biggest thrill.